Yes. Sound check 1 2. Sound check 1 2. Sound. Ladies and gentlemen, His Excellency Hassan Joho, the Governor of Mombasa.
Did you sterilize hands before you touch this thing? No, for yourself. Where's the other guys? Can you give us like a few minutes? Tuone wengine wakifika. Haya basi na tena mutulize mambo ya rates. Wake mumo kweli mambo ya corona alafu mtatutia huko kwingine. Na mambo ya BBI tutaanza baadaye. Where's the county commissioner? Where is the resolution? Inaletwa. Mabibi na mabwana, kama mnavyojua, katika vita dhidi ya usambazaji wa COVID-19 na coronavirus, serikali ya kitaifa na Mheshimiwa Rais Uhuru Kenyatta walikaa wakatengeneza mienendo ama mipango hasusan njia ya kudeal na maradhi haya na njia ya kuprevent na kadhalika. Na kulitengezwa jopo in every county ya kurespond na kufanya mambo yanayostahili. Na every county, the county commissioner na governor wana co-chair. So myself and the county commissioner, we co-chair this team. So what we have done this morning is to have convened a meeting ya agencies tofauti together with the political leadership to discuss and agree what we locally need to do in terms of preparedness, and primarily now we're talking of preventive. What measures do we need to put in place to ensure we are ready and we prevent the spread in the county of Mombasa? So I will invite or introduce my co-chair, the county commissioner, to give you a few remarks, and then we'll read out to you our resolutions in regard to the meeting we've just had. Co-chair.
Thank you very much, and thank you for your patience. This emergency committee has met today, and we have deliberated on a number of issues which we need to implement within this county in order to prevent the spread of this disease. We have tackled a number of issues which will be read to us shortly. But what we are requesting for maximum cooperation from both members of the public and the government agencies and even the private actors. Because this is a serious illness which has come to our country, and we must stop it from spreading. We also need the cooperation of the members of the press, like yourselves, because we need to spread the message on the kind of precautionary measures which are required to ensure that the disease does not spread. We know there are so many challenges. This is a big city. There are so many issues. We have tried our best to cover each and every one of those areas. And we believe that we will be able to succeed. With the cooperation of everybody, we will be able to succeed. Kwa hivyo kwa lugha ya Kiswahili ni kwamba tumekaa kama kamati hii na kuna mambo mengi ambayo tumejadiliana kuhusiana na mambo ya corona na kuisimamisha ifika Mombasa hapa. Tumeangalia sehemu nyingi. Tunajua hii ni city ambayo iko na mambo mengi ambazo ziko complex, lakini tumejaribu uwezo wetu kuangalia mambo ambayo yanasafanywa katika kila kona ili kuwezesha hii ugonjwa isisambae zaidi. Na tunaomba kwamba tunataka ushirikiano ya wananchi, ya mashirika ya serikali na pia wale wa kibinafsi, ili kwamba tuzuie mambo ya magonjwa haya kusambaa. Na hiyo ripoti tutasomewa kwa dakika chache zijazo kwa zile mikakati ambazo tumeweka ili kuzuia mambo haya. Mimi nashukuru viongozi wale wamekuja kuwa na sisi, viongozi wa kisiasa na wengine, na tuko kama timu moja hapo Mombasa kuhakikisha kwamba hii ugonjwa haifiki kwetu na tunaidhibiti kwa njia ambayo ni nzuri. Naam, asante.
Asanteni. There is one point kabla tusome hii ambaye probably both of us have seen happen in Nairobi. People rushing into supermarkets to be able to stock food and maybe basic supplies. In our opinion, there are other urgent matters that must be done to prevent than keeping food. So don't panic in that you ensure you have a full storage of supplies at home. They are the things that we need to do to avoid to get to a point where we all need to isolate ourselves. And that is why we are seeking for cooperation. Everybody on this one, tafadhalini, let us work together. Everybody. From the civil society, to the fourth estate, to us as political leadership, to the religious leaders, to literally everybody. On this one, let us work together. And we advise learning from expertise that we have gotten from the advice from our experts, and we share it with you. So whatever we are going to tell you that has been resolved here today, it is absolute goodwill and for the best interest of our city or our county. Tukubaliane. So we are asking everybody, na tumeona kuna watu ambaye wameanza, but it's been announced. There are people who are hyping these issues, more particularly on social media. Some are even making a joke out of them. Let me assure you, the government will come for you. Kama unatumia hii to create hate and to create fear, and panic, that shall not be entertained. But let me go back to the resolutions of our meeting today. So the County Emergency Response on COVID-19 Committee meeting on Saturday, 14th March 2020. Resolutions from Mombasa County Government, preventive measures are to be followed collectively, the national government and the county government and other agencies. Number one, in line with the national announcement, to suspend, we're saying this to re-emphasize what had already earlier been said by the Minister for Health. To suspend prison visits for the next 30 days. Number two, to minimize visits to the sick in hospitals. And we want to say that both public and private hospitals, we are urging that families are restricted to 2 immediate family members for visits. Number three, suspend all inter-school functions. Number four, suspend all public gatherings, meetings, and events. Number five, suspension of inter-agency, inter-institution, inter-religious meetings and gatherings. Number six, we have agreed that we shall run a door-to-door sensitization campaign on good hygiene and hand wash. Number seven, religious institutions to provide worshippers with sanitizers, soap and water. Hotels and all institutions to be provided to provide clients with sanitizers, soap and water. Number eight, consultation with health institution to get the right message. So what we're going to do, we are consulting with our doctors to issue one clear message that will be shared with everybody. So meaning, once we get the health experts do the messaging, we are hoping you and ourselves would spread it so people understand it. Now, specific areas of concern in the county. Number one is the ferry. So we have said hand washing provisions at both sides of the ferry, which will be enforced by the Inspectorate and NYS and other security agencies, to ensure that there are facilities for hand washing on both sides of the ferries. And that shall be enforced by NYS, Inspectorate, and other security agencies. We have also told the ferry that the TV screens and the speakers that are there now to guide the people must be used for sensitization to the members of the public for the purposes of preventive measures. Number two, SGR to provide all passengers with sanitizer and involve public health and NYS at their stations. Number three, we are going to run an aggressive campaign generally, but more focused on highly populated areas like the slums and what have you. All markets, aggressive hand-washing campaign must be run. Number five, point of entries. Committee has resolved that agencies put in place necessary measures on all points of entries, like it had earlier been announced. And we had agreed where there's shortage of human resource collectively, we shall find ways to mobilize more numbers of personnel, if it's from county or wherever it is, any government body. Number six, and the last one, we are announcing here today that all nightclubs in Mombasa must be closed for the next 30 days, starting today. No nightclubs shall operate. We are also announcing that bars and restaurants shall be allowed to operate until 11 p.m. and minimize on their music. How they play their music, that shall be managed. No loud music in bars and restaurants, and it must be closed at 11 p.m. As to the discos and the nightclubs, shall remain closed for the next 30 days starting today. Tumelewana mpaka hapo? Tumelewana mpaka hapo? But what we are saying is that every institution that is working, public, transport, and every other institution that is in operation, they have to provide adequate sanitizers, whether by way of washing hands, liquid soaps, and what have you. Tumekubaliana mpaka hapo? Ama niseme Kiswahili sasa hii? Tumekubaliana? Yes. Kwa Kiswahili, eh? Maybe wacha my coach aseme Kiswahili.
Fikiria wewe ndio unajua Kiswahili zaidi. Sawa, hii ndio makubaliano ambayo tumeafikia kama kamati. Nitapitia moja moja ili kusisitiza yale yalipitishwa na National Committee. Kutembelea wafungwa jela kwa siku 30 zijazo haitaruhusiwa. Wale ambao wanatembelea wagonjwa hospitalini itakuwa wanaruhusiwa watu wawili kwa kila mgonjwa kutoka ile immediate family. Mambo ya shule, ile michezo ya shule moja na nyingine, hiyo inasimamishwa, hizo functions inasimamishwa. Mambo ya mikutano ya hadhara na mikutano ingine, hizo itasimamishwa kwa siku 30. Pia zile mikutano ya interagency, ile agencies inakutana ama shule kwa shule, hiyo pia inapigwa marufuku kwa siku 30, ikiwemo mikutano ya kanisa ambazo kanisa moja, mbili ama tatu zinakutana. Kama watu ni kuomba, waombe tu kwa ile kanisa yao, lakini hakuna kukutana kama kanisa mbalimbali. Namba 6, mambo ya kuhamasisha wananchi itafanywa kutoka kwa mlango hadi mlango. Wale administrators wetu watawala na watu wa afya watakuwa nazunguka kutoka mlango mpaka mlango. Na hizo mashirika ya kidini kama ni msikiti ama ni kanisa, wanahimizwa waweke sanitizers ama vyombo vya kuosha mikono nje ya kanisa ama nje ya msikiti kabla hawajaingia ndani. Na hiyo pia mahoteli vile vile, institutions zingine na hata maofisi ya serikali wanastahili kuwa na sanitizers katika milango zao. Namba 8, idara za afya itatoa ile message moja ama ujumbe moja ambao utasambazwa na ambao utasisitizwa na viongozi. Kwa hivyo utakuwa na message moja ambayo itazunguka. Yale mambo ambayo yanatuhusu hapa moja kwa moja hapa Mombasa. Feri tumesema katika sehemu zote mbili za feri itawekwa mahali pa kunawa mikono na sabuni ya kunawa. Na itawekwa mfereji ya kutosha kwa kila mtu kuweza kunawa. SGR pale kwa reli, wale wanasafiri na reli watawekewa mahali pa kunawa mikono na kufanya mambo ya hygiene kabla hawajaabiri hizo reli. Katika sehemu ambayo iko na watu wengi katika kaunti hii, ikiwemo slums na sehemu zingine, itafanywa campaign mahususi kuhimizia watu mambo ya kufanya hygiene mzuri na kujikinga na hayo magonjwa. Hiyo vile vile itakuwa hivyo katika sehemu za soko kama Kongowea na soko zingine, watapewa messages ya vile watajikinga na kufanya hygiene na kujikinga na hayo magonjwa. Kuna zile sehemu zinaitwa points of entry. Points of entry ni mahali wageni wanaingilia nchi yetu, kama vile port ya Mombasa, kama vile airport na sehemu zingine. Pale pia itawekwa mikakati maalum ambazo itasaidia hiyo ugonjwa isienee. Na la 6, mabaa ambazo inaitwa night club. Mnajua night club, mahali inapigwa muziki na ngoma na disco. Hiyo inapigwa marufuku kwa siku 30. Lakini ile baa ya kawaida watafanya tu kazi mpaka saa 5 ya usiku, wanafunga na wanapunguza mambo ya muziki ya usiku huo. Kwa hivyo hiyo ndio mambo ambayo tumeafikia kama kamati ya kulinda hiyo mambo ya corona hapa Mombasa. Asante.
One final announcement is that we've also agreed to set up a hotline. Wakati unashuku unahitaji msaada for yourself ama mtu ambaye unaona anahitaji msaada, we're going to read out the numbers, but also we'll publish them in the dailies, probably starting tomorrow or Monday. So we have a U-line that is 0777777242. Yani 0777777242. We also have an Airtel line 0734881233. And we have a Safaricom line that is 0793390984. Tafadhali watu wa Fourth Estate, help us to publish these numbers so that when you have an issue, even for clarification, kwa simu hizi there shall be medical officers or experts ready to respond to your question. So ukiona unajisikia hali ambayo uelewi, you have a line to call for the purposes of getting help. Sijui kama tumepatana. So it's a hotline that is ready to respond to any queries or assistance that anybody would need. Asanteni sana. Yeah, wacha
kabla ya swali tafadhali, kabla ya swali tutawashauri wale Wakenya wenzetu kwamba mtu akijipata na condition kama hiyo na ako pale nyumbani, kitu ya kwanza kufanya ni kujitenga na kupiga simu kwa hizo hotline ili wahudumu wa afya waje pale wafanye ukaguzi na waamue vile watafanya. Kwa hivyo mtu akiwa na dalili na shuku asianze kusafiri kuita majirani na ingine, subiri pale, upige simu kwa hiyo hotline, wahudumu wa afya watakuja pale pale na kuamua vile watafanya. Naam.
took the issue resolution kila kitu. But the problem in this one was we are doing the second week, tuna shida maji. How will you do it when tuna shida maji?
I have a question, Governor. The status of the isolation order was we've been told that there is an isolation order, but are the masses very confident that we have an isolation order? What is this an isolation order? Number two, on the status of our streets, ECD is under the county government. How safe are our streets in these places?
My friend, let me tell you, and this is one thing we need to understand, and my request to all of you, let us work together. Don't look for criticism alone. It doesn't help. Because, my friend, the first world, we are as susceptible as we are. So there is no two categories here. At sijui huyu ni school ECD. My friend, university is not different from ECD under this circumstance. So we all must be ready in one way or another. That is one point. The other point on the isolation ward, we have announced it. We have the entire Rehamtula unit that is ready. We had built it. Mungu ametusaidia. We had built it as a private unit at the Coast General Hospital, which have every room that is en suite. So we're ready. We're ready. God forbid that it reaches here to a point where we have to use it, but we are ready. Today we even discussed as a committee, we have already built other level 4 hospitals in Marimani and in Mtongwe. We're saying there's a need for us to agree on equipping it to be prepared as an isolation ward going forward, because these are facilities that are fully built but are not opened. So don't ask me if an ECD is more susceptible kwa sababu iko chini ya county. Hata wewe chunga, ukipanda matatu sanitize yourself. Hata mimi and anybody else. As to you, these are the issues that we have to deal with. But you can't tell me because kuna upungufu wa maji, I'm not going to wash my hands. You took a shower before you came here. So yale maji ulioga nayo tu mwosha nayo mkono. Really, sikusikia ukinuka jasho hapo umeoga. You see, you can't determine the number. You cannot determine the number of cases that you're going to deal with. But today, what we have at Coast General is a 19-bed facility. But the other places, we've already looked at the possibilities of creating over 30 beds facilities. And we have the infrastructure ready. What we need to do is put the ventilators and the medical equipment to prepare ourselves. But nobody can be able to tell you today, you would need this number of beds in isolation. No, that's a lie. Yes, Mtalaki, and the final one. Sasa nitakwambia, we'll both answer the question. Nitakwambia number one, the preventive measures that must take place does not begin at the ferry. Even that ferry user comes from a home. And that's where we are saying we shall run a door-to-door campaign from those households. So tukitoka nyumbani umejitayarisha. But what we're going to do, because you move from one point to the ferry, and the numbers at the ferries are big as you know them, we're going to provide that facility. We have directed as a committee that by Monday morning, there must be water and soap or chlorinated water to the levels that can be able to sanitize your hands. So that you have that option, wash mkono. But the sensitization program is that you're told how to behave, how to move. Kiona mtu ambaye ako na nini, ako na kusneeze na mafua na nini, how to behave and stuff like that, that we're going to tell you how to do it. But then again, remember the numbers are big. We run a campaign. We provide the facilities that we can. both at the ferries and the households. Mengine sasa ni sisi to take up our responsibility as citizens. Mimi na wewe kujichunga, sivyo? Because I cannot come and hold you, nikwambie mkono wako usifute uso. But I can tell you, tafadhali usifute uso kwa sababu ina madhara fulani, sivyo? That is one point. The other question you've asked, Mtalaki, the president has announced the measures that we have done what? Re-emphasized. And to make sure there's a follow-up so that hawa watu ambaye the implementing agencies are fully aware and they're implementing. So we have taken it upon ourselves, me and the county commissioner, as the co-chairs of this committee, to make sure whatever pronouncements that are made in Nairobi are followed up. It's as simple as that. Are followed up and are implemented. So hayo yote hayo tumeyafuatilia. In this meeting, by this that you know, tuko na mtu wa airport, tuko na mtu wa KPA, tuko na mtu wa Kenya Ferry, tuko na mtu wa Port Health hapa, and we've asked them questions. Ni nini mumefanya paka sasa? Where do you think you need help so that we can step in and help you? Where is your challenges so we can try and resolve them? And we're moving forward. So please help us. You, me, and everybody must run this campaign. Asanteni.
Well put together, congrats.
You can give them.
You can share with them.
What I share, what I can have one, eh?